So for common complaints, what are kind of like some of the things that should cue patients in their brain to say, I think I've got a problem in my low back other than my pain is here, but what are maybe some of the activities that they'll start to pick up and register? Oh, I think this is like a lumbar erector or just like a lumbar region issue in general.
Um, yeah, it could be like carrying around infants, toddlers, newborns, something like that. Um, yep.
Yeah.
Any type of you know, like twisting motion, or something with work where you're doing like any type of like turning, where it's you know things involving the hips,
Yeah.
things like that. So it can be many
Yeah.
activities that are
Yeah.
um
And I love because this kind of goes
mhm,
back to the causes of pain. Ben just
mhm,
said the things that were on the overactivity, right? So a lot
mhm,
of repetitive bending, and then that starts to
mhm.
hurt after a while.
Yep.
Let's think about maybe like something that could also trip up the erectors would be like, say, the gymnast or the cheerleader that's doing a
Mhm,
lot of back handsprings and keeps loading up and over recruiting the
mhm,
muscles in that direction.
mhm,
Again, alluded to like the swinging
mhm,
sport athletes, our baseball,
mhm,
our hockey athletes.
mhm,
And golf when the weather gets
mhm,
nicer, not when it's snowing outside.
mhm.
But
Yep.
like those, but again, just like the common complaints that are going to exist in activities as
Mhm,
well too. So
yep.
find a lot of times with the low back
Mhm,
tension. That those will be the people that will say when I wake up first thing in the morning, my back is tight, and it takes
mhm,
like 30 to 60 minutes of just general movement
mhm.
to get the low back muscles to calm down.
Yep.
Also, again, sitting like, hey, I used to be able to sit for 2 hours without my back like getting tight,
Mhm,
and now I sit, and after 30 minutes, it's starting to talk to me and let me know that there's a
mhm,
problem. And then I go to stand up, and I used to just be able to
mhm,
spring up with ease, and
mhm,
now it's like, oh, okay, give me a second here.
mhm. Yeah.
That's if
Yeah.
you're getting that, that's a time to make
Yeah.
a referral to get
Mhm,
some massage work and get some
yeah.
body work or chiropractic work and
Mhm.
get that issue back under control. So
Yeah, so like particularly occupation of office workers, and since it's getting towards the end of the year, we can pick on accountants a little bit as well, and
I guess we're getting into that territory. Yep.
tax preparers,
Yeah.
especially with the peak season, probably doing overtime sitting, and you know,
No question about that.
yep.
So, good. I think that's pretty good for our
Mhm.
common complaints. I mean,
Mhm.
there's certainly more than that, but that's a
Mhm.
fairly comprehensive list.